So what about C-section? C-section, you have to put firmly, and then you have to cover her stitches firmly like this. If there is a pillow, tell her to hold the pillow firmly so that you do not dehisce her. Remember, her uterus has been stitched as well as her skin and muscles. So you should give some pressure, firm pressure, so it does not open up. So that's how we do it. If the C-section is like this, then you put your hand above like this and like that. This is how you protect her incisions. Please check her incision for redness, any kind of fluid coming out. What is going on with her stitches? Has it been opened up? Is there foul smell to it? What does all that mean? You need to know her incision site as well, because this is important. So let's say she had a C-section and her cut was here. This is how firmly above the pubic symphysis bone again, and also supporting the stitches, you need to check for her fundus. Same as before, go underneath like this and find it. Now with the C-section, her fundus has moved to 1 finger above the umbilicus. So you, again, if it's not firm, if it's boggy, you cup the fundus and massage and look for the bleeding. This is not comfortable when they have a C-section, but it's important to keep the fundus firm. Please keep the fundus firm. And when you come to me, I will show you what is a boggy fundus and what is a firm fundus when you touch this. This is boggy. This is not doing anything. This is firm. This is something I'll teach you how to do it so you know what it is to check for the fundus to be firm or boggy. Remember, it's important to keep on massaging till the fundus is firm. So that's that. Then you clean her up. Make sure you don't put the same pad. There is a pad now that comes with ice already in it. The only thing is it doesn't soak the blood well, but it also helps her with all the ecchymosis and if she has either lacerations or if she has an episiotomy. The difference between laceration and episiotomy is a control cut that the doctor does. It's a 4-stage cut. The 4th stage is all the way to rectal sphincter. They cut it so that the baby can come out. The laceration is jagged cuts that she tore. She tore as she was delivering the baby. So those are harder to heal and they will bleed more. So if you see bright trickle bleeding, that's coming from either lacerations or episiotomy. If bright red, trickling. If it is dark red and it's coming in clumps, that's from the uterus. That's the difference between the bleeding of lochia as opposed to actually bleeding from laceration or episiotomy. Please understand the bleeding types as well. And she can die from episiotomy, bleeding, and laceration. So you need to catch that quickly as well in order to prevent that. Please know that the patient can die within less than 10 minutes if that is happening. Because if she has delivered vaginally, she has lost 300 to 500 cc of blood. If she has done vaginal or C-section delivery, it is anywhere from 500 to 1,000 cc of blood. So you need to understand she has already had lots of fluid loss. And if you do not take that under control, the bleeding, there's going to be a problem. She'll go into a DIC, which is disseminated intravascular coagulation. Then she will go into hypovolemic shock and death. And that can happen within 2 minutes. So they have a machine in the hospital unit where the machine drops spines, 1 unit in 1 minute, 1 unit in 1 minute. And they have these special machines for bleeding to do it. So that is something you need to know. What kind of blood do we give her when she is bleeding? That's something I want you to tell me as well. That's one of your lab works that you need to understand. What lab works do you order when she is bleeding so much? So you will know what type of blood you need to give her. Once you've done, clean her up and then give her decency by covering her up here and then come here.